KOCT e-newsletter.
Welcome back to Journals Roundtable. I'm Kent Davey, the moderator. I'm joined by Allison St. John from KPBS, Logan Jenkins from UT San Diego. Our next guest is Nate Kaufman, a San Diego-based hospital analyst who has recently written about what he thinks Tri-City Medical Center or district should do about its hospital and the arrangements that are there. Allison?
Okay, so we've had so much in the news about Tri-City because the board has had some characters on it who really didn't appear to be working towards the best interests of the hospital. Now the board appears to be a little bit more stable. Is the problem with the hospital the people on the board, the people running it, or is it basically an old-fashioned model that doesn't work anymore?
Yeah, the problem's structural. If you look at the competencies and structure that you need to be successful in this new post-reform healthcare environment, Tri-Cities has none of it. It has no ability to employ physicians through a foundation. It's a standalone hospital competing against billion-dollar multi-hospital systems.
Explain how it's different from, say, Palomar Hospital, for example.
Well, let's talk about Scripps. Scripps has 4 or 5 hospitals. It has the ability to create a large physician group through employment. It gets economies of scale, economies of expertise. It just performs better, and when you look at how the market rewards or punishes a health system, Scripps is very profitable, and Tri-Cities is kind of teetering on financial difficulties.
But is that because of the fact that it's like a publicly controlled hospital with a publicly elected board? Is that why it's having such trouble?
Well, that's one of the problems. When you have a publicly elected board, these are well-meaning people, but they don't necessarily have the competency to deal with all the nuances in healthcare. I'm on a board of a hospital in Pennsylvania. The reason they wanted me on the board was to make sure that their strategies fit with kind of what the national consensus was. I'm afraid that when I look at the strategies for Tri-Cities, they've been heading in the wrong direction for a long time.
Are we talking about two different things, though? On the one hand, we have public hospital districts, which have their way, have their rules for how they do business, and on the other hand, this sort of expansion or collaboration with other hospitals. Those are two slightly different things, aren't they?
Well, I guess we have a good example of a success in Grossmont. They were a hospital district, but they realized that as a standalone facility, they probably wouldn't survive. So early on, they affiliated with Sharp, and now they're very successful and very profitable. So it's possible for a hospital district to survive and succeed, but probably not as a standalone entity.
Isn't Fallbrook also a public hospital district, and they went to and partnered with a private hospital company, as I recall?
I believe so.
Is that a viable model?
Well, the real question for a hospital is, will it have access to capital in the future? You have to build new towers and buy new equipment, and the real question is, if you don't, or the real issue is, if you don't have enough profitability, then no one's going to lend you any money. And that's the problem with Tri-Cities. They're financially stagnant, and the bond market's not going to provide them with additional funds. So unless they affiliate with a well-capitalized entity, they're basically stuck.
But that could be either private or another hospital district.
It absolutely could, yes.
But a lot of people in Oceanside depend on Tri-City. I mean, that's their local hospital, and I think people are a bit afraid that if it gets bought up or partners with some commercial enterprise, they may say, well, we don't need this hospital. You can travel to Escondido or down to La Jolla to go to the hospital. I mean, is that a risk?
Well, first of all, I have no axe to grind with Tri-Cities. I'm here because I'm so frustrated with the direction the hospital's taken over the last 5 years. And so I feel bad for the people of Oceanside that their hospital's not moving in the right direction. The real risk, I think, is that it's going to be up for a fire sale. The performance of anything has deteriorated over time. Its ratings on the web, it's got a 60% ratings for people who would recommend the hospital versus 69% for the state. The time it takes to see a provider in the emergency room is 58 minutes versus 37 minutes for the state average. The hospital's not performing well, and it's not because of external forces. It's because it doesn't have the economies of scale, economies of expertise, and funds to do what needs to be done for the population.
Given what you know about our marketplace, could you ever see Palomar and Tri-City merging or collaborating in some meaningful way?
Well, unfortunately, Palomar has its own problems in that it's built this new facility and its bonds were recently downgraded, and so it has some similar problems to Tri-City. If you look at the health systems that are in the most difficult financial position in San Diego, they are the standalone hospitals, essentially. And so I would think that both of those facilities will eventually have to merge. I'm not sure they would merge with the same, merging with themselves wouldn't help. Merging with one of the strong systems is probably the best bet.
But didn't the Fitch rating in their analysis of it suggest that Palomar, in fact, had been taking some steps that looked like it should push it back into a profitable status? I don't know that it ever was. I don't remember the details.
Yeah, the benefit for Palomar is they have a new hospital.
Right.
That's the big benefit. Tri-City needs a new hospital. The problem is that they don't have the financial performance to get one. And so ultimately the problem,
And
merging the two.
and then they lost 2 bond issues on the topic.
Right,
in a
right.
row.
So and the bigger problem that I'm really frustrated with is their solution is to hire another CEO. And one of my friends was recently contacted by a headhunter. Now, they said in the paper that the idea was to hire a CEO to establish an affiliation with somebody.
Mm-hmm.
Well, my friend, when he was contacted, there was no discussion about affiliation. It was just, how would you like to be the CEO of Tri-City?
Mm-hmm.
So if you get a good CEO, they're going to come down, they're going to try to convince this public board, hey, we can make this organization work. We're going to go another 3 or 4 years of stagnation before finally they're going to have to sell. So to me, the real issue is they should be hiring an investment banker to help them find the right partner so the hospital survives and is successful.
So who of the health systems in San Diego, or might it not be someone in San Diego, might it be somebody from Pennsylvania that would buy it? I mean, wouldn't it be better to keep it local?
I think yes, and I know the health systems very well. I know all the CEOs, and the CEOs are very interested. There's a good fit between Scripps and Tri-City because of the Encinitas connection, because Scripps has an affiliation with what used to be my client, Sharp Mission Park Medical Group. So there's a nice fit there. That would be a good choice for sure. But again, if you go down the 405 and 5, and even Hoag Hospital, which is Newport Beach, was a very successful standalone. They merged with the Sisters of Orange, recognizing that as a standalone entity they couldn't survive.
Is this a national trend then that is just being replicated here in Oceanside?
It's a national trend that I would argue is being fought against in Oceanside, and that's the problem. M&A activity around the country is increasing at a rapid rate, and there's a general industry consensus that a standalone hospital, especially one with relatively poor financial performance, cannot survive long term.
In your experience, where does the pressure come from to actually, as you would say, force the board to face reality?
Unfortunately, that's what I see. As you project out into the future, since the board is not focused, I think, in the right strategic direction, the pressure will come from financial stress, possibly bankruptcy. It's interesting that since I wrote that article for the UT, I haven't been contacted by a single member of the board. Again, I'm not looking for anything but trying to help the organization be successful, and yet they're not really interested.
Well, I mean, there is this concept that if you've got a publicly elected board, they're responsible to the public, and they feel probably that responsibility quite strongly. And if it's bought out by a private, another private health system, then they might feel like they were letting go of that responsibility they were elected to maintain.
Well, if you talk to the board members at Grossmont, I would probably say they would argue that they ensured the success of that organization. El Centro Hospital, which was a client of mine for many years, said, we can't survive as a standalone entity. We want to make sure this hospital succeeds. We can't get the capital that we need without having a strong partner. And so they went on a process to identify that partner.
So the public health district would remain. There would still be a board, but their duties would be much curtailed. Is that correct?
That's one of the structures that would be possible. Possibly there could be some funds for public health that they could manage. There's multiple structures. The issue is to get away from this idea that as a standalone facility, there's any plausible possibility of surviving.
Do you think it's possible the pressure could also come from the public that would perceive anyway that the standard of care at Tri-City was inadequate.
The problem you have is that healthcare is so nuanced that it's very difficult for the public to know, which is one of the reasons that public hospitals struggle, because elected board members who care about the public don't necessarily have the knowledge and can be taken down rabbit trails that lead to poor strategy, and you only find that out when there's a real problem.
Is there any significant chance that the performance of Tri-City at the, say, the present time is really reflective of the turmoil, not as opposed to it being a sick organization somehow? If I don't know if I'm making myself clear. They've gone through Anderson's dismissal. They've gone through all of the board struggles with Kathleen Sterling and so on. Those things could they have roiled the waters enough to keep it from being a successful hospital?
My opinion is in the environment today, given all of the pressures and new tensions from the Affordable Care Act, even a well-tuned standalone hospital like Tri-Cities would need a partner. But when you add to the fact that there was turmoil in administration and in governance, that really put them behind and makes it even more urgent for them to change the course and become affiliated if they want to continue to serve the population.
But is anybody going to want to buy a hospital that perhaps has been mismanaged, or, as you say, is they need a new hospital? I mean, would anybody want to partner with Tri-City?
Yeah, I've talked to many of the hospital CEOs, health system CEOs, and they'd be anxious to affiliate with Tri-City and maintain it as a viable entity and part of their system. So, yeah, I think they would. And they have the resources to do it.
And possibly build a new hospital, because the earthquake retrofitting is one of the big issues.
That's correct.
Yeah.
That's correct.
Well, that's all the time we have on this particular topic. Thank you, Mr. Kaufman, for coming in. Stay with us, and we'll be right back in a minute with Kathy Kean, who's going to be here to talk about bicycle safety and related kind of topics.
On the surface,